The recognition that this provides Hospice of the Valley and our palliative care programs is really awe-inspiring. It means that all the hard work that we've put into developing a safety net for our community is being recognized for both the innovation it represents as well as the outcomes that it provides to our communities. We were really early innovators when it came to palliative care. Starting in the 1990s, we began formulating a palliative care program to provide support to patients before they were ready for hospice, recognizing that this was a critical time for them where their chronic illness was becoming a burden and yet they weren't quite eligible for hospice care, and so there was no safety net for them. In the early 2000s, we were able to bring a product to market and to get payers to see the value and the benefit of that. So some of the ways that we've been able to grow that program into other programs that support our communities, our Palliative Care for Dementia program, which provides support to patients with dementia and their caregivers. We have a pediatric palliative care program, which is very innovative, as well as a palliative care and hospice program, which provides support to families where the birth of their child is not likely to be compatible with life. And one of our foundational values at Hospice of the Valley, including all of our programs, is think yes. So when there's a problem that's presented, whether it's something that is identified by a health system, a hospital, a community member, or an idea that's brought forth, it really is in our DNA to say yes and then figure out how to make that happen on the back end. And I really think that that, combined with more than 40 years of being a member of the greater Phoenix community, means that people think of us and they come to us with both their problems and their needs and allow us an opportunity to help bridge those gaps. Some of our very best programs that we are being reimbursed for today started out as a pilot or an idea that we funded out of either donated dollars or other contributions to see how we could provide value within the community. So if you start with the dollars in mind, oftentimes the answer will be no. If you start with the community that you serve in mind, oftentimes you find a path that really leads to some pretty amazing things happening.